The third freedom, the one most near and dear to my heart, is the freedom from pain, injury, or disease. And this is accomplished by prevention or rapid diagnosis and treatment. And this is where us veterinary folk are needed most. And this is when you should be relying on us the most. Our training, our knowledge, our expertise should all be considered as the primary resource above all else. And you should have a relationship with a veterinarian if you're a responsible pet parent, period. Preferably established before you even have or acquire this animal, because there's a veterinary shortage. It's a real problem. Now, the best medicine, in my opinion, takes place before a problem ever even occurs. What makes me a decent doctor in my day is my ability to foresee a potential problem or a hazard and minimize that risk or eliminate it entirely before it even happens. One of the most frustrating fights I have ever had was about a wood pile stacked on the inside of a fenced-in yard for dogs. I have seen far too many dogs get hit by cars because that wood pile became a stairway, basically for these dogs to get out of their safe and protected space. Why would anyone not move it after hearing those horror stories about traumatic accidents? Prevent it before it happens. This is the same reason why we use vaccines, why we use anti-parasitics or dewormers, why we use protective gear on our animals in sport, and why we try to reduce environmental hazards. You see a sharp nail sticking out in your barn, then maybe a human or an animal could get caught on it. So remove it. Get rid of the potential problem. A cord hanging from window coverings or blinds that could potentially strangle someone, a human baby if not an animal, tie it up. If it's weighing the risks and benefits for every decision we make, then always try to reduce risk. Work with the people who were trained to help, even in times of good health. Wellness visits matter. And when you do see an animal who is sick or injured, it is your responsibility to do something about it. When you can identify that there is something wrong with your animals, basically any deviation from their normal behavior is considered significant. They're creatures of habit. One of my favorite quotes that my hospice clients hear me say all the time is that doing nothing is wrong. And let me tell you a little secret. If you want to get in your good graces with your veterinarian, be one of our most valued VIP clients. We love a heads up. I mean, it's that simple. We love when you call the first day you spot a concern, make an appointment for the next day, if not later that day, just in case things become urgent. We love cancellations and postponements far more than emergency situations. And if we're talking about a medical emergency, some examples would be a broken leg, hit by car, gaping wound, was in a bad fight. We have a pregnant animal that's in labor, but you're not seeing any babies come out. An animal who will not stop vomiting. Time is of the essence in these situations. Delaying contact with a medical professional can not only have a negative impact on the outcome of the case or for the animal, but often it gets more costly to help. And like I mentioned before, money talks. So if you're complaining about the high cost of veterinary care, as everything's expensive right now, and you want to wait until your pet is on death's doorstep to reach out and get them into a hospital, it's going to take a lot more money to save them and to pull you out of that incident. Another one of my favorite sayings is when people reach out to me and they express concern for their pet, and then they ask, "What should I do?" Or worse, is it okay to wait? Like they're looking to have me give them permission to hold off. Even though I don't know them, I haven't seen their animal, which, by the way, is generally considered malpractice to advise on a patient you've never physically seen. FYI, you're literally asking a vet to break the law and be a crap doctor. I say this, if this were a human under your care, child, elder, disabled person, what would you do? Would you be on Facebook asking a group of strangers with no medical training or advice what to do? Or would you be presenting them to urgent care or the ER as soon as possible? And more importantly, consider the fact there might be legal consequences if you do delay taking action. And remember that animal cruelty and neglect are punishable offenses, just like in human med. So it's something to think about, right? The next time you find yourself wanting to ask other people for medical advice about something that's going on with your animals, make sure one of those first calls or messages that you send is to a veterinarian. Doing nothing, if you think your pet is sick or in distress, is wrong.